You are tuning into the Lehigh Low Ego, High Impact Mindset podcast. I'm your host, Volkan Emre, along with a dynamic team of Kellogg School of Management alums. We are here on a shared mission to uncover the mindset that drives impact and success. On Lehigh, we have thought-provoking conversations with incredibly successful entrepreneurs, business leaders, and investors from around the globe. We uncover the mindset that drives them, allowing them to make a high impact without losing themselves to ego. Now, let's get started with today's episode. Hi from Chicago. Today, we are with a special guest, Greg Parranto. He is a leading figure in orthopedic trauma and medical device sales and a seasoned U.S. Army veteran who served in various critical missions in different countries and war zones. Greg is currently the CEO of Endeavour Orthopaedics, a specialty medical device company focused on advancing orthopedic trauma products. As the CEO with a history of leadership at DePuy Synthes and Johnson & Johnson, Greg brings a global perspective on orthopedics, innovation, and market insights. Greg holds an Executive MBA degree from the Kellogg School of Management and degrees from Webster University and the U.S. Military Academy at West Point. Join us as we delve into Greg's expertise in shaping the future of medical devices and his leadership mindset. Thank you very much, Greg, for hosting me at your house, like in Naperville, Illinois. It's an honor to be here. Thank you very much for your hospitality.
Oh, thanks for coming. It's always good to see you.
Yeah. Let's start with our rapid fire questions to get to know you a little bit better. Are you ready?
I'm ready.
Okay. Coffee or tea?
Coffee.
Dogs or cats?
Dogs.
Mountains or beaches?
Mountains.
Text or call?
Text.
Music or podcasts?
Music.
Okay. PC or Mac?
PC.
Drive or fly?
Ooh. Both? Both.
Yeah, it can be both. Yeah. Why not? Yeah. What's worse? Dishes or laundry?
Ooh, laundry.
Okay, why? I'm really curious about it, like, because this question is the one that I'm really interested in learning more about, like people, the thinking process and the emotions of people. Why do you think laundry is worse?
Well, I feel like I can't screw up dishes. It's pretty easy to wash a dish, you know what I mean? I know exactly how to do it. I can clean them by hand. I can put them in the dishwasher. It's good, right? If I've got my wife's laundry or my daughter's laundry,
I see.
Like I'm pretty confident I could screw that up and do something wrong, right? So, all those chores, you know what I mean?
The process and the choices, individual choices and preferences. Oh, I see. So what's the first app you open up in the morning, generally?
Oh, probably the Wall Street Journal or some sort of a financial app. There's a few of them that I have.
Wow. Okay.
Just to see what's going on in the market for the day, what to expect.
Okay. Wow.
I mean, I'm also checking my email. I take that back. First thing I'm doing is going to check, just texts and emails and see if any communication came in, over the night. If something came in, I'm going to jump on that right away. But for my own education, it'll be some sort of a news page.
If you see like an urgent email, do you immediately answer like after you open it up, or like do you then go to Wall Street and come back to that email?
Depends on the email.
Okay.
Right. It depends on who it is. If it's an emergency or if it's something that can wait for a couple of hours. So it depends.
Okay. Great. Greg, can you start by giving our listeners a brief introduction to your background and your journey from West Point to where you are today?
Absolutely. I think I have to start a little bit before West Point, just from where I grew up. So I grew up in Minnesota, and through high school, I was raised by my grandpa and grandma. And, I really want to go to college. The expectations for me from my grandparents was not college, right? They wanted me to get into landscaping or start a trade job. And I was focused on figuring out how I could get to college and kind of broaden my horizons. And so I looked at ROTC scholarships, knew I needed to find a way to pay for college. And through those ROTC programs, I found out about West Point. And everything about West Point appealed to me. I liked the service. My dad had enlisted in the Navy when he was younger and was a medical corpsman. My grandfather fought in the Korean War, was enlisted when he was 17 years old. So there's a history of military service at the enlisted ranks. I like the idea of going in as an officer and trying to figure it out. So the service really appealed to me. And when I looked at what West Point valued in their students, you didn't have to be the best athlete. You didn't have to be the best academically. You didn't have to be the most popular kid, right, to get into West Point. But you had to be good at everything. You had to be an athlete. You had to be an academically successful student, right? You had to have some sort of leadership experience. And those were things that I could achieve, right, that were in my wheelhouse, if you will. I was never the best athlete. I was never the smartest kid in the room. But I was always there, right, and enjoyed those things. So I focused on that broad experience set and focused on getting in, right? When I got into West Point and went to West Point, that's when the world really opened to me. I hadn't traveled out of Minnesota. I hadn't traveled out of the United States. My sphere of influence was pretty small, right, in high school in the big picture of things now. When you went to a school like West Point, you've got students from all over the world. I had a good friend from Turkey.
Yep.
Who was, we've talked about him before.
Yeah.
Great guy. And classmates from all over the United States with completely different backgrounds. Some were military brats and grew up, their whole life with their parents in the military. Some of them came from wealthy backgrounds. Some of them came from less, wealthy backgrounds, right? You had folks who enlisted and were just rock stars in enlisted military that then transitioned into West Point. It's just a phenomenal group of people with very, very diverse backgrounds, cultures, ethnicity, but we all had that shared value of service to our country, a sense of duty. Everybody was an athlete. You have to be in sports. While you're there, everybody had that academic threshold where they were curious and they wanted to learn, and just a great group of people. And so that was the appeal and probably the best thing about West Point. Going through West Point's a leadership school. And so you focus on learning how to lead people. When you graduate from West Point, you will be a second lieutenant. You're going to have a platoon, depending on the field. If you go into, there's some areas, if you go into military intelligence or you go into aviation, you might not have a 30-person platoon, but the majority of folks are going to have, 30 people that report up to them that you're responsible for. And so you focus 4 years on how to lead people in an organization and how to coach and mentor and build people up. And
also from very diverse backgrounds, right?
Absolutely.
Yeah. Very
diverse backgrounds. And we can talk about that. That was actually an interesting point. And, later on, we talk about the whole diversity and inclusion.
Yeah.
That's really front and center, right, in corporate America and in the world right now, which is an excellent thing. That's something we were talking about 25 years ago at West Point, right? It was very focused on, and it's different today than it was then. And I've had to make some changes in my own thought process. But it was a nice thing at West Point because diversity was definitely a focus. So a lot of lessons there, great education, opened up the world. And then from there, to give you I branched engineers, became a combat engineer. What I liked about the engineering branch is in the military, you could be a combat engineer, construction engineer, civil, go work at the Corps of Engineers. So you could have a career that has a lot of doors open to it. And so I loved it. Branched engineers. And then if you want a quick overview, I went to, was down to Fort Leonard Wood, Missouri for the officer basic course, did airborne school, ranger school, and went to Germany for 3 years, served in Kosovo for 6 months as an executive officer, went to back to Leonard Wood as for the command course and captain's career course, then to Fort Lewis, which is where I did my company command for a year. I was a lead engineer planner for Southeast Asia, so spent a lot of time in Southeast Asia working with foreign militaries over there, and spent a year in Afghanistan as a company commander. And really the highlight of my career, the most responsibility, it was an honor to serve over there, and we could get into that we could talk for a couple hours on a podcast on that experience. But worked with some phenomenal people. Then went to DC for a year and made the transition out from DC.
So, and in total, post West Point, your military career lasted for how many years?
8 years post West Point.
Okay, post West Point, including West Point, it's about 12 years. Yeah. So then you mentioned how your West Point background and experience shaped your early leadership style, and you highlighted the importance of managing people with diverse backgrounds in really international situations. And I think when you were pointing out like your assignments, I mean, I could catch like at least 3 different continents like over there, right? In just like 8 years, like you have done really a lot. Like it sounds like different geographic locations, team responsibility, different functions. And reflecting on your military service post West Point, what was the most significant lesson you learned and that you have carried forward into your business career?
Yeah, that's a tough question, because if I were to ever write a book, not saying I'm going to write a book, it would be on those lessons from the military and how they transition into corporate America. There are so many valuable lessons from the military to the civilian business sector, and just from prioritization to teamwork to leveraging the strengths of the other folks. I see a lot of leaders in corporate America, and you see it in the military, but in corporate America, you see leaders who get into a leadership position and they bring people in that they know that reinforce their decisions and their behaviors. And I think that, that's not my style. I would prefer to bring in folks that have expertise that I don't have. I want a very diverse group of people around me that are going to challenge me and going to bring new ideas. And you read about that all the time, but you don't see it in reality as often as you should. And I think you get that from the military because, as you mentioned, you change jobs. Every year, 2 years, you're changing jobs in the military, and they might be completely different roles.
Yep.
And you can't make those transitions without the experts there to help you out. And I think that the military structure is nice. You have NCOs, enlisted soldiers that have worked with the soldiers and specialized in areas for their entire career. So you might be new to a job, but you've got somebody who's been doing it for 17 years, for 20 years. They really know what they're doing. And you have to learn to trust that individual, to work with that individual, but also to question if the wrong things are there. You're the leader, but you've got to bring in that expertise. That's a nice thing about the military, because that structure, that foundation is there in most cases. Whereas in the civilian world, a lot of the times you have to build that. In corporate America, you have to build that culture and bring in that expertise. And so you have to actively look for it.
Greg, everything that you said about your military career sounds like fascinating. But you had a transition. You transitioned from Army to the medical device industry. What motivated your shift from a military career to the medical device industry? Maybe in general, a private sector in general.
Yeah, that's a great question. I would say that when my military career started, my intent was to stay in for 20 years. The intent was to make the military a career. And I loved the military. I loved the soldiers I worked with, the challenge that we were faced with, and I enjoyed the camaraderie, the environment. I liked my time in the military. With that being said, I got married in 2004. My daughter was born in 2007, and I was traveling an awful lot with the military, and I did have the desire to stay home and be a part of the family and be there for my kids. At the time, we had the wars in Iraq and Afghanistan going on. I had many peers that were gone 2, 3, 4 years out of 5, 6 years. I mean, you were gone more than 50% of the time, like 75, 80% of the time overseas. So there was that aspect. The biggest thing was I was personally frustrated with the conduct the war in Iraq and Afghanistan from a political standpoint. I didn't see an exit strategy, and I questioned the overall strategy that the U.S. government at the time had with the conduct of those two wars, and we were losing soldiers. People were putting their lives on the line. I felt an obligation to stay on through company command, to deploy, lead to soldiers, get them back, get the mission done, and bring as many back alive as possible. That was what I trained for. That was the job. But after company command, you go through a phase where you're a staff officer, 7-8 years before you take over battalion command. And my frustration with the direction we were going on in the military, I felt like it was time for me to vote with my feet. It was time for me to say, okay, I'm uncomfortable with the direction we're going, and it's a volunteer service. It's time for me to depart. Very, very tough decision for me, but I made that decision, and I have a tremendous amount of respect for my peers, my classmates that are still in the military that didn't make that decision, because our soldiers, sons and daughters of this country, right? They need good leadership, and I know a lot of great folks in the military that are still there for them, and I respect that. So that was a tough decision. But when I made the decision to get out, I didn't know what I was going to do. Right? I was pretty open ended. So I went through a recruiting firm that placed junior military officers with different companies, and I interviewed in all kinds of different fields. I interviewed in the finance sector, interviewed with Lehman Brothers. I'm glad I didn't take that job. Interviewed with John Deere, Caterpillar, some construction type companies, an oil and gas company, ExxonMobil, all great companies. And then I interviewed with a company called Synthes, which is a medical device company. And I remember sitting down for the interview. I did some prep learning about it, and that regional manager who was hiring explained to me what you do as a device sales rep. That you're the expert on the equipment. You're in the operating room, and you're helping to teach surgeons how to use the equipment so that they can help patients. And it really appealed to me. First of all, I have such a tremendous respect for healthcare workers, for surgeons, for nurses, and that stems from my time in Afghanistan. The medical care that we had downrange was unbelievable. We knew that if we could keep somebody alive, get them on a helicopter, they were going to be in an operating room in a tent someplace 15 minutes away, and they were going to get world-class care. And I can't tell you how much that means to a soldier that's forward deployed, that's in some dangerous situations, to know that they've got that level of care right there at their back. And those nurses and surgeons, a lot of them were civilian, right? And they were on the National Guard or, in the reserves, and they would come over for 6 months and operate on soldiers. They could have been home making a lot more money, doing a lot bigger things, but they were out there with us, and a lot of respect. So when I found I could go into this field and work with people that I truly respect and help them do their jobs on the civilian side, I was all in. So I canceled all my other interviews and focused on getting into the device space, and joined Synthes as a sales rep, and did that for 3 years. So it was a great experience and a great transition, and now I've been in the medical device space for the last 16 years.
About the transition, in transitioning these roles, industries, I will say the ecosystem, basically, were there specific strategies or mindsets or strategies that help you to adopt in this new field?
I would say yes. When I looked at the device space, I felt like I wanted to start in the sales arena just because that was the tip of the spear, right? I felt like in order to earn some credibility, to really understand the industry, getting out in the field, spending time with the customer, with the surgeons in the operating room, carrying the bag, if you will, was an experience that I wanted for credibility. I didn't go into it with the plan of doing that for 15 to 20 years. A lot of people do and have a great career focused on the sales side. I wanted that really more as an experience and to prove myself through hard work and success, and kind of make a name for myself, if you will, within the company by being successful in sales, but then to leverage that into a broader career in the company. But in order to be successful as a sales consultant, you're working with surgeons, highly educated folks, and so you have to be able to communicate with them in an effective manner, right? And being a military officer working with senior leaders from across that helped make that transition, right? Because you worked with people, on some pretty deep issues and had to plan and had to come up with, your strategy in the military for how you're going to tackle a mission. It's a similar thing in the OR. The surgeon's got a patient, and they've got to figure out a plan on how they're going to treat it. And so just that experience helped bridge that gap. There's also a humility that comes along with being in the military, that you're a part of a team. You're not the shining star. You're not the center of attention. You're part of making the organization successful. And in the operating room, the surgeon is a center of attention, but you've got your anesthetist, you've got your nurse. You're there just to facilitate, to help make that group and that team successful. And the center of attention is the patient. Everybody's there to make sure that patient gets the treatment they deserve. And that military background really helped with that. And I would say, as a sales leader, within J, I hired a lot of athletes. And again, that wasn't because of their athletic prowess, right? It was because of their ability to play on a team and to work with others. You get that from the military, you get it from athlete, from sports, you get it from a lot of different things. So I'm not saying military is the only way to make that transition, but it definitely helped me make the transition.
Great. Mm-hmm. And let's talk about post-transition and your career in corporate America. And you had a very impactful career at really large corporation. And working for large corporations often involves navigating complex structures and dynamics, like similar to the Army. Can you discuss a challenge you faced in this environment and how you overcame it? I think it would be good to have an example to basically see your mindset like in action. Is there a moment that you can give an example, like in
moment? I would say I'll give a couple of challenges, right? Yeah. Just challenging things that I had to navigate, which were different from the military to corporate America. One, after I was in sales, which I did for 3 years, I moved into a role where I led global product development and marketing for our maxillofacial business, all the bones in the face, and had a team in Switzerland, a team in the U.S. I did that job for 4 years. I loved the job. Worked with surgeons from around the world on developing new products. Worked with our engineers, our marketers. It was a great team. I did that job for too long. I did it for 4 years. I really should have done it for 2 to 3 years. And then once I got that experience, I should have moved on. Now, J&J acquired Synthes in that 4 years, so there was a retention bonus, and they wanted to keep me in the role. And I stayed in the role and was kind of the team player and said, I'm going to keep doing this. I should have been more proactive and switched roles 2 to 3 years into that. And looked for another experience in my career, because my goals of advancing my career and taking on greater responsibility was slowed down because I spent too much time in the military. That you don't have that option, right? In the military, you're changing jobs every 2 years, and you rely a little bit on the structure of the Army to help manage your career in looking for the next role. In corporate America, you don't have that. You own your career in corporate America, and it's very easy to become comfortable in a role. The job becomes easier. Other areas of your life, take a greater priority with your spouse, your children, community, the activities that you have going on. And if you want to manage your career and you want to advance it, you have to take ownership of it. And so I stayed in that one role longer than I probably would have liked to have. The second thing I would say on a leadership side that was different in the military, it's a volunteer force, right? Everybody comes in and they have different backgrounds, and part of your job is to turn these young people into productive members of your organization. You can't fire them, right? They volunteered, right? You have to build a team out of the resources you have and the folks that you have. Now you can advance them. There's positive reinforcement. There's some negative reinforcement, but you work with what you have, right? In corporate America, these folks are making a lot more money, right? They're competing to get these jobs. And if they're not performing, you don't have to coach and mentor and develop them. And I actually had a boss at Synthes who said it really well. And it was a good lesson that he said when he's evaluating talent, right? Is it a can't or is it a won't, right? And if somebody can't do their job, I can teach them, right? Like that's my job as a leader. If they don't have the tools and the resources to do their job, then okay, I need to find a way to give them those tools. I need to find a way to work with them to educate them so that they can do their job. And that's part of my role as a leader. If they won't do their job, if they're not showing up on time, if they're not doing the work that is required to make themselves successful, well, then they need to go, right? Because I can't, I mean, you can motivate them, but there's other things for me to spend my time on. And that was a big difference from the military to the civilian world of building your team. You know, you want A and B players, and the C players, there's a role for some C players, right? But if you're in a fast, high growth team, you need to manage those folks out.
So what I'm hearing is lack of tolerance for lack of performance, and also the ability to change the mix when you can. Yeah. And possibly, correct me if I'm wrong, or like if you think differently, it's like more awareness on the limitation of resources. You have like these resources for a limited time period. You or either make it or not make it. It's a little bit, I think, different than the military environment, because yes, in every setting, the resources are limited. However, the limitation seems to be like different, and it seems that the pressure for performance may be higher in corporate America if you are not in like a military like conflict like situation, maybe in relative comparison. So with that, let's talk about the teams, right? Like you talked about, there are people, there are wants and can'ts, right? Am I correct? That was the analogy?
Yeah, that's a good way to look at it. Right?
Okay. So with that, now you are with a group of people whom you like vetted, and then you work with them, right, in corporate America. And then you led a lot of teams. I think you formed and led a lot of teams in very different instances. How did you ensure that your teams remained innovative, competitive in such a fast-paced medical device market?
Well, I think that goes back to the leadership style, right? And I've always said that I have a subservient leadership style. You know, my primary job as a leader is to set the folks on my team up for success. So initially, when you're building a team, you've got to bring in the right talent, right? And so you have to know people, you have to interview them and get to know them, and make sure that you're bringing in people that, you know, bring that diverse background that we talked about, and have the right work ethic, the right vision. They buy into what you're trying to do. So you put together that team knowing that you're going to have conflict, right? I want to have conflict. But I want to have conflict in a positive manner, right? And you need to manage that, but you want them to challenge you. And I'll step back. One of the things I said that I learned in the military, and it was just something that I said to every new organization that I had the opportunity to become the leader of, and I've carried that through to the civilian world, is every time I take over a new team or I have the opportunity to lead a new organization, I get the leaders together, right? Get the team together, and I always say that I never make a mistake on purpose. I just don't do it. But I make mistakes all the time, right? Mm-hmm. And what that means is I need the folks around me. I need the leaders on my team to let me know when I'm making a mistake. Like I value and I appreciate the person on my team that pulls me aside and says, "Hey, Greg, I think you're doing it wrong here, right? I think you just made a decision that's going to be detrimental to the direction we're going, to the team. I think you just offended this person, and you need to go address it," right? I need folks on the team that have the courage to come up to me and challenge me and tell me when I'm making a mistake. Because if they think I'm making a mistake, I don't know I'm making a mistake. And so it's a very simple phrase. It's just, look, I never make mistakes on purpose, but I make mistakes all the time. And I say that to every team I go into. So that's part of building the team, to build that courage. The other scenario, if I'm talking on leadership or the characteristics of leaders, is I always talk about the 4 C's, right? And I think there's a lot of different people that say the 4 C's, and they all mean different things. For me, the 4 C's of leadership is competence, courage, candor, and caring. And when I'm looking at competence, like you said it in my career, I've changed roles in completely different sectors in different areas, which is fine. You've got that underlying leadership experience. You've got the ability to learn something. You have to acknowledge the fact that you need to be competent in your role. You have to take the time to learn what it is that your mission is, what your area is. If I'm going into the medical space field, I need to start reading medical journals. I need to understand the why of what we're doing so that when I'm talking to a surgeon or I'm talking to a customer, I can explain to them, in their language, right? I can talk in medical terms to what we're trying to treat. You have to have that competence. And that's in anything. If you're going into a manufacturing business, if you're changing businesses, you need to take the time to not only become competent, but also be able to demonstrate that to the team around you, because that builds confidence in your organization and in you. The next thing is courage. And when I say courage, the military, everything's physical courage. I think it's more the mental courage. It's like I said before, of having the courage to challenge me, and then also having the courage to challenge your boss, right? To challenge the organization higher up. If you think there's a mistake, it's my obligation to tell the organization that I think we're doing something wrong. You have to do it in a tactful way, in the right way, and eventually, your boss might come to you and be like, "Look, Greg, I've had this conversation many times. I appreciate you coming to me, but no, this is the way we're doing it." And it's okay. And then I'm on board, right? But I fulfilled my obligation of at least voicing my concerns, and that takes courage. Also, being able to talk to your subordinates in a candid manner, which is the next one. Takes courage too, to have the hard conversation. So when I talk candor, that's really, I think, goes both directions, right? When you're talking to somebody on your team, you need to give them the constructive criticism of what they need to do to become better. You need to talk about what their goals and aspirations are and what the path to get there is, and what their limitations are, or what you see their limitations being, and this is how they can address those limitations. Here's your strengths. So having candid conversations is very important. And then caring, you have to care, right? If I ever find myself in a job where I stop caring about the outcome, I need to go, right? You have to care about the people that you work with, and you have to care about the direction you're taking your company or your business. If you don't have that passion for what you're doing, then something's missing.
So that's, you really summarized it greatly. And it seems that it's all about collective success. And I really get your answer like that. In order to ensure the teams remains competitive in a fast-paced medical device market and in any professional environment, it seems that your leadership style is all about winning collectively in a transparent, honest way.
It is. And then, but I would also say, getting to that fast-paced growth environment, when you're setting your vision and your expectations, I'm all about setting aggressive expectations, right? You get that team together, you have that foundation of trust and camaraderie, but the expectation has to be aggressive, right? We're going to shoot for 500% growth this year, depending on a startup, right? Something else, it might be 10% is aggressive growth, right? But if you're launching a new product, or if you're doing something new, the standard might be 24 months. Hey, we're going to knock this out in 16 months, right? We're going to try and accelerate. So I've always been somebody who tries to push that envelope, and then set, you've got that aspirational goal that you're setting. Then you also have your realistic expectation, right? And you've got to manage between that. So you're managing the pressure. But I like everybody to be on board with that aggressive approach to push the envelope, right? You want to challenge people. And it's fun to challenge people. And then when you achieve it, you celebrate those successes.
Can we go through these 4 C's one more time?
Sure.
It is
competence,
courage,
candor,
and care. Yeah. Can you share an experience where you had to make a tough decision that significantly impacted the direction of a project or the company? I think you can probably give a lot of examples from your military days. How about an example? Can you think of an example during your career in corporate America where you had to make a tough decision that significantly impacted the direction of a project or the company?
There's been quite a few decisions along the way. One of the challenges for me personally of working for a large company like J&J was a lot of the really meaningful, impactful decisions were made 2-3 levels above me, right? And my job was to execute those missions, or execute those decisions, in a way that influenced the outcome in the direction we were trying to achieve, right? And so there was decisions that I could make that were in my control, but most of them were in execution, right? How do I execute this? How do I get it done? There were some larger decisions that were made that I disagreed with, right? And so there was a specific example, which I did agree with. This is a good example. When I was for DePuy Synthes, and just not to get into all the specifics of J&J, we made a strategic decision to get into foot and ankle, right? Into extremity sales. It was an area that we were underpenetrated and we wanted to focus on. And so I was made the national director of extremity sales, specialty sales. I built a team of about 100 extremity specialists all over the country. But that team was built under the existing structure that we had in place for our sales leadership, which I think was a flawed structure. And so the team that I built was put in place to address that structure, right, and drive growth in extremities within that structure. And it was working. And we hired 100 people, and it was great. And then about 3 years after we built that team, the decision was made to correct the overarching structure, right? And we broke apart the organization. We created more focused sales organizations, with our trauma line, our sports medicine line, which, again, in my opinion, was the right decision to do. But now my organization no longer fit in that broader structure. And so we had to lay off. I got the call. My entire team got laid off. Mm-hmm. And that was a challenge because in broader J&J, it was just, hey, here's a severance package. This team's going away. Now, at the same time, we were creating over 100 leadership positions throughout the new organization, and we were able to retain. Like, my job became, hey, here's the bad news. This team we just built up, which is performing, now needs to transition into a new organization. And we were able to keep about 60% of the team, and many of them got promoted into management jobs. I was very proud of that, right? And I was proud of bringing in that team and creating it, and a lot of folks were able to advance their career in it. There was about 40% of the team that left, and there were some really good folks that we lost in the organization. So managing through that was a challenge for me, and that was a moment that made me start thinking, okay, I need to transition out of J&J because it was a situation I needed to manage. But man, if we had put the foundation in place, if we'd thought through that process better going into it, we could have retained a lot more talent. We could have retained a lot more business. It could have been done in a lot better way instead of being made at a board 2-3 levels above me, and then I just had to execute it in a very short period of time. It was frustrating. And that's the big company type stuff that you have to lead through, which is fine. That's the job. But being in a smaller company in the entrepreneurial space, I feel like now I have more of a say in how we build the foundation, right? And how we set it up so that we're still going to have hard decisions down the road, but hopefully we can mitigate those and minimize them by the foundation that we're setting right now.
Yeah, actually, it's a perfect transition point right now. So it was a really great example for a tough decision that significantly impacted the direction of a project in the company in corporate America where you used to be. So with that, now there aren't like any layers above you, right? You are at the top right now, and you are giving the direction to the organization you are leading right now, as you mentioned. So how about the mindset change, like in this role for you? Now you don't have these restrictions that you used to have in a large corporate America setting, and I have to believe that there was a shift, like in your mindset. Or is there a shift in mindset? Maybe I should not just be so certain about it, but But then if there's a change in the mindset, like what is that?
Yeah. Well, first of all, I would say, for the company that I'm with now, it's Endeavour Orthopaedics. I mean, I do have a boss, right? They have a board of directors, right? Mm-hmm. They were conducting a search for a CEO. And so when I came in, I met with the founder, Dr. Brent Norris, who came up with the device, came up with the technology, and met with the board of directors. And they're the ones that hired me and offered the job, right? And so right now, when we have our board meetings, I answer to the board. You do have a boss, right? But it's definitely all the decisions you're involved in, right? There aren't decisions that are being made without your or without my involvement, which is nice. And I'll tell you, the board of directors is a phenomenal resource because they have experience that I don't have. And so from that standpoint, it's still that subservient leadership, right? You need to have a little bit of humility, right? And being able to take direction and learn from those around you. And one of the first questions, Dana Funk, who's our COO, throwing names out here on this podcast, but Dana's built companies, he's sold companies, he's a great guy. He's the chief operating officer, one of the founding founders of the company. And when I was talking to him prior, I was like, why aren't you the CEO? Like, you have all this experience. And his answer was great. It was just, look, I've done this in the healthcare space, but I don't have orthopedic experience. And we're looking for somebody who's going to be the CEO who can engage with our surgeon customers, with investors, with strategic buyers, acquirers of the company down the road that has that deep orthopedic experience. And that's where you come in. And great answer. And so when I look at it, I mean, I'm the CEO, he's the CEO, we're partners, right? And I'm learning from him every day with his experience set. So that's a big part of this job. The other thing is it's faster moving, right? We make a decision. You have a call, you get together. Hey, this is the thing. Okay, let's do it. That's the route we're going. So you can move so much faster in a small organization, whereas in a big company, you've got all kinds of levels of bureaucracy and approvals, which is frustrating and slows down the process. But I would say at J&J, everybody recognized that slow process, and that's why a lot of their development and all of your big strategic companies in the medical device space, most of them don't do their own development anymore. They're acquiring the small companies. They let the small companies move fast. Some fail, some succeed, right? And when they find a technology that's successful in making an impact, improving patient care, and has that high growth opportunity, they acquire those companies. And that's an exciting phase to be in, to find the technology that you really like and then say, okay, let's grow it to that point where the larger companies are interested in acquiring us. And I've always wanted to do that, and now I'm just starting, and it's going to be fun. It's a challenging ride, but it's fun.
Along the lines of the challenge or challenges, right? How do you maintain balance and handle pressures that come with being at the top of the leadership ladder in an organization that has that vision and pressure to grow fast?
When I look at the pressure, it's interesting. In the small company environment, there's so much work that needs to be done. And it comes down to prioritization. It really does. Like, what am I going to focus on today? Because you could work 24 hours a day and not do everything that you need to do or that you could do to make the company successful. And when you look at that prioritization, it's important just for your own sanity and your health and your family to prioritize your family, my kids, prioritize, their school and activities, my wife, the community, my friends, doing this right now with the Kellogg, you have to prioritize that with work. So when you look at that prioritization, you got to set your boundaries and say, okay, this is when I'm doing this and when I'm doing that. And another analogy I've always used is it's like juggling balls, right? I mean, if you've got rubber balls and you've got glass balls, and you got to know which balls you can drop and they're going to bounce back up and you can keep juggling them, and which balls, if you drop, they're going to shatter and that opportunity's gone, right? You're not going to be able to pick that ball up. And the challenging thing of juggling is the balls change from rubber to glass, right? So they might be rubber today, but tomorrow it's a glass ball. You better not drop it. And that's the analogy I always use when I'm talking about prioritization. It's complex. It's challenging, but you've got to look at it and say, okay, what decisions do I need to take today? What actions do I need to do today? because it's a finite opportunity. And that goes back to the beginning of our conversation. You're asking me about what do I check first? When I check my emails, I'm looking at those emails and saying, is this a glass ball or is this a rubber ball? If it's a glass ball, I'm going to prioritize it and get on it right away. If it's a rubber ball, then I'm going to go have breakfast and drink a cup of coffee and check the news, you know what I mean? And I'll get back to it later in the day. And so that's the light on prioritization that I always look at it.
And that's a way to basically handle the pressure, like the fragmentate or basically mitigate the risks of the pressure, maybe.
Yeah, I mean, having a plan, and being able to prioritize helps alleviate the pressure because you're moving forward. I think when the pressure gets overwhelming is when you're like, I don't have a solution for this problem, right? And that's when the pressure mounts, and you're saying, okay, I need to solve this problem, right? Because this could be catastrophic, for the company, and that's when the pressure is higher, and all of a sudden work becomes the priority, and other things take the backstage. But you get through it. That's part of the job.
I have a question about like this. It's definitely prioritization can be a very, very tough undertaking, and I think risk assessment really plays a very important role in that. How do you, in general, like assess? Like, what is your mindset in assessing risks? Because some risks may be really just like noise, and some of them can be like really serious. I think where you are right now, like really assessing like these risks when you are also doing this prioritization, may be really critically important. Like, how do you assess risks in general?
I think the risk comes down to managing risk. You have to look at what the impact of the risk is. Everything's a conscious decision. And so if you're looking at the outcome, and if the outcome is catastrophic, then I'm not willing to take that risk, right? If the upside far outweighs the downside, then maybe I'm going to take that risk. And risk management, again, is something you studied at West Point. It's something that was active in the military. And the previous question was on pressure. I've never had more pressure than I did as a company commander in Afghanistan. I mean, soldiers' lives were on the line, right? Mm-hmm. And you had to make decisions based on getting the mission done, and an outcome was the lives of your soldiers, right? And so you were out there with your soldiers every day, and that was a high-pressure environment. Now that I'm in the corporate America side, I tell myself nobody's going to die because of this decision, or at least in the industry that I'm at, people aren't going to die because of the decisions that I'm making. And so that helps to alleviate some of the pressure. But with that being said, making ethical decisions is critical, right? If you're launching a medical product that's going to get implanted in patients' bodies, you can't take shortcuts, right? Like, you have an obligation to ensure that what you're putting to the FDA is honest and clear, and that you're doing everything with your best of intentions, and you're educating surgeons on the proper way to use an implant, because that could affect somebody's life down the road. That could affect, their mobility, right? Their mortality rate with the life, depending on the type of implant you're developing. And so you do look at it in those lights, and you can't sacrifice your integrity or your ethical decisions that you're making. And that's not a high pressure decision, because for me, that's a no-brainer, right? It's not a high pressure decision. You're going to do what's right for the people that work with you and for your company. And if you look at that in terms of risk, that's a catastrophic failure as well. If you make an unethical decision and that has negative consequences, your company's going to go under, right? You go to jail. You can have a lot of issues. That's an unacceptable outcome. So that's a risk that's not even on the table. And it makes it easier when you have strict values and you follow that. You follow your basic integrity. You follow it. That's the wrong word, right? But you follow your values in making the right decision. That alleviates a lot of your pressure as well, because you're confident you're doing things for the right reasons.
So I understand it's actually, rather than a mindset, it's like a values topic, like when it comes to really assessing risk in the industry like you are in right now. And it sounds like integrity really matters. And then if you stick to the right values and stick to the value integrity, like in your decision making process, automatically you are taking like less risks, putting everything aside.
You are. I mean, you don't get me wrong. You're going to. Those are for the big decisions, right? There's a lot of decisions. Like right now, we have one product in our company, but I joined the company not for that one product because it's a platform technology, and we can bring that to a dozen other clinical indications, right? And so I'm excited for the product and the direction we're going to go. The next product that we launch has some major strategic decisions. If we launch a product that's not successful or doesn't have the demand or the market space, like that would have a very negative impact on the company. If we launch the right product, then it catapults us to success, right? And so a lot of work has to be done in making that decision and make sure we make the right strategic decision. And that's where we're going to talk to surgeons. We're going to do a lot of clinical research and try and make the right decision. But there's not a lot of pressure or not losing sleep over it because that's not going to be a catastrophic failure. It might slow down our growth if I make the wrong decision. If I make the right decision, it'll be very rewarding, right? I'm confident we'll get to the right decision. And so that's not a value-based decision. That's a market decision. But there's not a lot of pressure on that. That's just do it. Let's figure it out.
So I hope that you will have great success in the new product development. Towards the end of this podcast, I want to talk about Kellogg and the Kellogg impact. You and I, we are classmates.
Yep.
We finished Kellogg Executive MBA program back in June 2023. What is the Kellogg impact on your professional and personal life at this point?
Yeah, a couple of things. Again, I would go back to the people, right? When I said I went to West Point, it opened up the world to me. Right, that was because of the breadth of the people that I met and their outcomes. But the focus was on military service and leadership. And then when I got out and went into medical device, I still maintain my friendship with my military, friends and colleagues. But then in J&J, you're down that medical device challenge. You kind of get siloed into one industry and the challenges that you're facing with. And it's a huge industry, so you have a big network of people within that industry. But all of a sudden you go to a place like Kellogg, the executive program, and there's 60 of us, all different industries, all different experiences, very successful and intelligent people. And opens up a whole nother world to you. I mean, you're like, wow, that's really exciting what you're doing over there. And you see the parallels between what you're doing and what they're doing. And all of a sudden it just opens your vision, right? Your vision narrows as you get more comfortable in a certain space. It narrows as you get into focused into a certain space, and Kellogg just broadened that vision up again. And all of a sudden, you're looking at all kinds of different fields. I'm seeing folks that are successful in different industries that are acquiring their own businesses, folks that are investing in different types of business structures. We had surgeons, we had a good number of healthcare professionals in our industry that were looking to not just address their patient, but how do they improve global healthcare? I mean, people with very large aspirations and goals. It's just inspiring. And so I left Kellogg with just an invigorated mentality on what we could do next, right? What's the future hold? There's so many good people out there. And we were honored. I met you, great guy. You're running a podcast right now, something I've never done before. It's my first podcast. So it opens up, and you're doing much more than podcasts. But this is great. Love it.
Yeah. So far, so good, right?
Yeah. The other thing, I mean, the name of your podcast, the Lehigh mentality, right? It's, the low ego, high impact is something that really resonated with me. When I was looking for an MBA program, Kellogg has a great reputation, but the fact that they put this Lehigh mentality at the forefront of what they're trying to achieve and the people that they're looking for goes back to the quality of people that you get there. It's not about how do I put myself center stage. It's how do I build something that truly drives an impact. And that's the type of people I want to work with. That's the type of person I aspire to be. and Kellogg embodies that, which is great.
Yeah, and I remember all of our class discussions together, and it was really, it felt always like great to get your insights and your contribution to the class, and I really, really appreciated like being in the same classroom with you and learn from you. And actually, this podcast has been also a great learning experience for me about you, about like your impactful career and your vision, your mindset. Thank you very much for being on the Lehigh Mindset podcast. It's been a wonderful discussion. Really, thank you very much for hosting me in your house today. Thank you.
Oh, thank you. Vulcan was mutual. Your insights, everything, it was mutual. Everything you just said about me, I could say about you. So it's been a pleasure. Thanks a lot.
Thank you. Thank you for diving deep with us on another episode of Lehigh Low Ego High Impact Mindset. Join us every week as we discover the stories, strategies, and insights that will empower you to grow personally and professionally. Stay inspired and catch you in the next one.